I'm Dr. Nick Pejic from Atlas Psychiatry, and today we're talking about TMS and how we get patients all the way well. And I'm here with the wonderful Emily Lagarde Harper.
All right, so I have some questions for you today. What is TMS?
TMS stands for transcranial magnetic stimulation. This is the magnet here, and we use TMS to treat depression. And the way we do that is by holding the magnet up to patient's head and putting magnetic energy into their brain, and the magnet basically treats the depression.
And how does brain mapping work?
Right, so the brain mapping is essential because when you're going to use a magnet on your head, you need to treat the right location. And in this case, let me pull out my little brain here. This case, we have the brain, and the front part of your brain, called the frontal lobe, the dorsolateral prefrontal cortex, is the location where if you stimulate that with a magnet, like this, here, it will enhance this area and make it stronger, which reverses depression or treats depression. And the way we do the brain mapping, and to know where that location is we have a kind of special algorithm, but we measure the circumference of your head and a few other measurements specific to one patient, and we calculate exactly the point that we need to treat. There's a couple other ways we do it too, and we try to converge upon the treatment area. And let me show you this. This is a hat that we have folks wear, and I will write coordinates on the hat. I don't know if you can see it. And in this case, this hat, if we put this brain in here, the dorsolateral prefrontal cortex is right here. And every day the patient will come in, they'll put on the hat, and then based on specific measurements, we will then go over the same location every day. And that's how we know that we're hitting the right spot every day, because if you don't have the right spot, the treatment will not work.
And when would patients decide to start treatment?
Yeah, patients would decide to start treatment after being evaluated for 90 minutes by myself or Dr. LaRose. And what we do is we do an exhaustive history of what medications patients took. A lot of patients who do TMS do it because they're not responding to medications, or they're partially responding to medications. And what patients should know is that if they're not better within 5 different types of medications, that's more than enough trials of medications to suggest that they're going to need something more. And here what we use is ketamine therapy or transcranial magnetic stimulation therapy. And we will introduce the idea to them, we'll discuss the technology, how it works, and then they would come in for treatment. And we would consider that an augmentation to their current medications. Sometimes we're able to have patients taper off of medications if they get all the way well.
And how long does a typical treatment last?
The treatment itself is about 3 minutes long, and they might do that for 5 days a week to up to 6 weeks. And folks usually start to feel better within week 3 to 4. However, there's a new treatment that we do here that's based on new research, where they would do a 10-minute treatment about 10 times a day, and they do that every day for a week. And those folks have a high remission rate, so about 70 to 80% of people can get all the way well within just 1 week. It's a new technology and it's being heavily studied right now, but that's something that we did introduce. We've been doing that for about the last 2 years, and we have great results with that. But it's more intensive, so you would have to come and take like a week off from work and just do it within 1 week. But a lot of patients like that because they don't have to wait for 6 weeks to see results.
All right, well, thank you so much.
Okay, welcome, thanks so much.